that really is good news. Yesterday we opened it up to the age group of 55 to 59. We had 82,000 Hoosiers in that cohort sign up. We had another 27,000 who were age 60 and above, or healthcare workers. Others that were already eligible also sign up. So 109,000 Hoosiers signing up yesterday. That is really working our way toward that light at the end of the tunnel. And now it's, as Rachel informs you and me as of seconds ago, it's live on the website that we're opening it up to 50, age 50 and above. That's a big cohort when you think about 858,000 being 50 to 59, 858,000 Hoosiers who would be eligible. But with the new J&J approval, we're obviously able to do more. And we can talk a lot more about that in detail as the hour unfolds. But one thing that's allowed us to do is host mass vaccination sites in multiple areas. 4 we have in the queue, 1 coming up this Friday at the Indianapolis Motor Speedway. So thanks to the pit crew out there for making this all possible. We've had, as of right now, 4,200 Hoosiers sign up on Friday. We've had more than 3,000 Hoosiers sign up on Saturday. We'll be there on Sunday as well, and we take that as a very good sign. We're also, that next week, we'll be down in Sellersburg, Indiana, down southeastern Indiana, at Ivy Tech. Thank you to Ivy Tech for making this possible as well. And we're scheduling people there already, as you might imagine. And then we'll be up at Notre Dame. Thank you to the Fighting Irish. And then we'll also be in Gary. We'll hear from Dr. Box later in just a few moments, and then we'll hear from Dr. Weaver, and we'll hear from Dr. Walker up in Lake County as well inside this hour, and Dr. Shirley, who's been very instrumental, Dr. Walker and Dr. Shirley, in making this all. I mean, you started working on this a few days ago, but this has really come together fast, and then we'll be able to replicate this in some other areas. Having said that, I did not receive an order from you, but I did receive a very, shall I say, strong recommendation to walk the walk and not just talk the talk, and practice what I preach and be an example. So I will come this Friday, get my vaccination. I do qualify now, so I'm not cutting in line, but I'm eligible, and I want to be a good example on that front. I'm also pleased to report that Representative Shackelford will also be out Friday at the IMS, as will Senator Bray, as will Senator Taylor. So there's a number of folks. My congressman, Andre Carson's father, will be joining me to get his shot at the IMS site as well come this Friday morning. So that is, fantastic news that we continue to make this, methodical progress. We got a lot of other good news out there too, as I've droned on and on about in previous huddles. Our revenues are looking strong. We'll soon know about February's numbers. We'll confirm those soon. Our unemployment rate remains lower than most. Obviously, we had a record number of new job commitments coming to the state of Indiana last year in all of 2020. Q1, our first quarter pipeline so far for new job commitments is very strong, as strong as I've ever seen it. 89% of our schools reported last week through you all that they were open for in-class instruction, with about 10% with some variation of a hybrid model. Again, that's the local decision, but our county metrics, those color-coded metrics, continue to express the progress that is happening, and that's because of multiple factors, including our own actions. But when we're looking at today a reported 3.5% 7-day average positivity rate, it means we're continuing to move in the right direction. And again, I just don't want the gratitude that goes along with these press conferences for being able to share that good news and to make sure that we're continuing to balance the lives and livelihood side of the ledger. We're obviously coming up on Saturday, which is March 6th, which is a year to date of our first reported case. And so, yes, we have been through a lot together, and we're going to get out of this together, and we're pointed in that direction. And obviously, when you think about those principles that we shared, going back, it would have been about a year ago when we put those 4 principles up, and PPE availability, and having those resources on the ground, our hospitalization rates, making sure that we had the, doctors and nurses assistants and et cetera, on deck and on site, making sure that we got to the point that we were administering vaccinations. This is huge. And and testing and tracing and everything in between. And I mean, I count my lucky stars every day that we're having this discussion about hundreds of thousands of Hoosiers getting vaccinated. And we're not waiting 7 more years. Yeah. This is a really good thing. So we'll continue to drop this down, and I hope you will touch on, or Dr. Weaver will touch on as well, how we'll continue to take this age eligibility approach and methodically just mow our way through this and drop it down ultimately to 40. So we're at 50 right now, but when you stop and think about getting down to that 40 and having 90% of Hoosiers with comorbidities, by the way, covered because of the vaccination, or equal important, I'd love everyone to follow the lead, but have access to a vaccination. And we've tried to make that as easy as possible to schedule, get on your way, and get your life back. And so this is really good news. And March will, again, be a key month for most around the country, but certainly for the state of Indiana on the pace that we're going. So I say all that to not only tee you up, but to also say we did learn yesterday. I was on a phone call with the White House with the COVID-19 task force, the entire team with, I'm assuming there were 49 other governors, but more than that when you include the territories. Got off the phone around noon. And then just after 5 o'clock, we received word. So we didn't discuss this during the phone call, so we're still understandably trying to run down some details and some answers. But we received word from the federal government that they were going to provide doses to the federal pharmacy program for teachers to become prioritized across the country, obviously including here in the state of Indiana. So what that means to our teachers is, obviously, if you're 50 or older and you're a teacher, you're age eligible to go to any one of our sites. We've got almost 400 sites up and running. So multiple sites in counties. But also now they're going to fold in, the federal government will fold in their doses, their appointment regimen and scheduling process at Meijer, at Kroger, at Walmart. So that's when you think about the federal pharmacy program, there are those options as well for teachers of all ages and personnel. So again, I just ask for some patience on some very specific questions when someone is trying to make an appointment. But if you're living in pick a county that doesn't have a Meijer or a Kroger or a Walmart, you might have to go a county over if you're a teacher because you are eligible under that federal program. Now, we're still week by week planning out our process and allocation because we need some more answers on the volume of doses that we'll be receiving from the federal government. So what does this program, how does it affect the doses that we'll be receiving? But when you think about the 20,000 teachers who are 50 years of age or older that are now eligible anywhere, and when you think about the 18,000 of the 40-year-old plus that would be added into it, now you're getting to about 50% of the teachers. And obviously we're getting, just like the population at large, we're getting to those who most need to get vaccinated. So that's going to kind of mirror when you get to that 40-year old threshold. That's going to kind of mirror where we are as a state as whole. That's about 50% of total eligibility. So again, that's a very, very, very good thing. And with that, I'll turn it over to you.
All right. Thank you, Governor. Good afternoon, Hoosiers. It's hard to believe that this weekend will mark 1 year since our first case of COVID-19 identified here in the state of Indiana. It's been a year of trials and of heartbreak for so many Hoosiers, but it's also been a year that has shown us how resilient and how resourceful we can be as a state. A year ago, there was no testing available for COVID-19. We built that from scratch and now have nearly 300 testing sites across the state of Indiana, having done more than 8 million tests for more than 3 million Hoosiers. We had very limited capacity and relied very heavily on our partners to begin with at Eli Lilly to provide testing supplies and also to run tests in those early days. I know without a doubt that we would not be where we are today if we hadn't had that incredible partnership set up at our time of need. Today we have 10 labs as a part of our Indiana lab testing network, and more than 2,300 labs in total are reporting their results to us. Our local health departments and hospitals have stepped up in incredible ways, and we cannot thank them enough. A year ago, there was no vaccine for COVID-19, and if you'd asked me and Dr. Weaver, we would have been very pessimistic about it sitting here right now doing vaccinations. Today, we have 3 vaccines available, and we vaccinated more than 1 million Hoosiers. And as the governor mentioned, this week we expanded eligibility not once, but twice, so that Hoosiers age 50 and older can now receive a vaccine. The 1,031,266 individuals who have received their first dose of vaccine in Indiana as of today represent an increase of more than 110,000 people from last week. Of those individuals, nearly 607,000 were fully vaccinated, up from 483,000 from just last week. When you look at the age breakdowns for individuals who have scheduled or received a vaccine, you can see the steady progress that we're making. 70% of Hoosiers are 80 and above. 71% of those are 70 to 79%. 56% of those 60 to 69, and nearly 28% of those 55 to 59. These numbers include nearly 129,000 first and second doses administered to residents and staff in our long-term care facilities. We also have made a vaccine available to people undergoing dialysis, individuals with Down syndrome, people diagnosed with sickle cell disease, individuals who have received a solid organ transplant, and people who are undergoing cancer treatment or have had cancer treatment within the past 3 months. We've learned a lot of lessons this past year about the importance of training and of preparation, of pivoting quickly when new information emerges, of working as a team and not in silos, and of not being afraid to ask for help when we've needed it. We've also been reminded that pandemics are hard to defeat, that viruses mutate and present many challenges just when we think the worst is behind us, and that even positive trends like those that we have seen in recent weeks don't signal that we're out of the woods and that life could return to pre-pandemic normalcy. But there are a lot of positive trends to celebrate. Today, our positivity rate stands at 3.5%, which is down once again from last week's rate of 4.1%. And I actually looked up the last time I could find a rate that low was on September 17th at 3.7%. We also have seen another decline in the number of Hoosiers hospitalized with COVID symptoms. The number of Hoosiers currently hospitalized with symptoms of COVID has dropped below 800. And hospital admissions for COVID have fallen below 100 a day, which is incredibly encouraging. Our color-coded county maps also continue to move in a positive direction. The number of counties in blue has risen from 39 last week to 51 this week. Everyone else is in yellow, and it's wonderful to see no orange or red. Our advisory map, which indicates the level of restriction that counties must follow, shows just 3 counties in orange, down from 10 last week, and no counties in red. 31 counties are now at the blue advisory level, up from 9 last week. The majority of the state is at a yellow advisory level. The number of deaths we are seeing has fallen into double digits consistently. Today we reported 9 new deaths, which brings our total lives lost to 12,633 when you include both confirmed and clinically diagnosed deaths. I also want to talk about testing. Many states are reporting that they've closed test sites. That is not the case in Indiana. As I mentioned, we still have almost 300 testing sites available around the state. A handful have reduced their hours, but we continue to work with local clinics to ensure that they stay open to provide access to testing for their communities. We know that there may be a lull in demand for testing right now, but with variants emerging and becoming a growing concern, it's much better to maintain these testing operations than to have to rebuild them at a later time if we see a resurgence in cases. Finally, I want to provide another update on our distribution of PPE to businesses and schools. To date, we have shipped 255 orders to critical industry businesses consisting of more than 20,000 KN95 masks, 652 gallons of hand sanitizer, and about 24,000 packets of small sanitizer. More than 530 schools have received deliveries so far, with another 220 expected to be completed by Friday. These shipments include nearly 33,000 Bionex Now rapid test kits, 137,000 youth masks, 151,000 KN95 masks, 107,000 gowns and gloves, 60,000 gowns and 107,000 gloves, and 331,000 bundles of sanitizer, shields, and masks. Now it's my pleasure to turn it over to Dr. Weaver, who has some exciting updates about our vaccine rollout.
Thank you, Dr. Box. This week, nearly 860,000 additional Hoosiers became eligible to receive a free COVID-19 vaccine. That includes more than 446,000 people ages 55 to 59, and another 412,000 ages 50 to 54, effective this afternoon. Already, nearly 125,000 people aged 55 to 59 have scheduled or received a vaccine. More than 8,000 people have already registered to receive a vaccine at the mass vaccination clinic this weekend at the Indianapolis Motor Speedway. And nearly 3,200 have registered for upcoming mass vaccination clinics at Ivy Tech in Sellersburg and at Notre Dame. We still have slots open, so if you've been waiting to get the vaccine, please sign up. If you have a future appointment and are moving it to one of our Mass Vax locations or another clinic as we continue to expand our vaccine site schedules, please remember to cancel your original appointment so others can get signed up. If you have any difficulty, you can call 211 to assist you. We will begin Friday morning at the Indianapolis Motor Speedway and run through Sunday night. Then, the following weekend, we will head to Ivy Tech Community College in Sellersburg for a clinic on Friday and Saturday, March 12th and 13th. At the end of the month, we will go north to the University of Notre Dame for a clinic on March 26th and 27th. We are also working with the City of Gary to stand up a mass vaccination clinic on the west side of the city on March 20th and 21st, and we'll be sharing details once that plan is finalized. You will hear more from Dr. Roland Walker, the Gary Health Officer, and a local pediatrician about why this is so important shortly. These expansions are possible because of the incremental increases we have seen in our Pfizer and Moderna allocations, as well as the arrival of the Johnson & Johnson vaccine. Indiana is receiving 145,000 doses of Pfizer and 128,000 doses of Moderna this week. This includes both first and second doses. This week, we also have received just under 54,000 doses of Johnson & Johnson vaccine, which includes 21,000 doses we received on Tuesday for use at our mass vaccination clinics. The rest of the Johnson & Johnson vaccine will be distributed in coordination with both our current and new vaccine partners across the state. The Johnson & Johnson vaccine, which you might also hear referred to as the Janssen vaccine, is a safe, highly effective vaccine that requires just one dose to provide protection from COVID-19. This allows us to more easily host mass vaccination clinics like those planned at our northern, central, and southern sites this month. This is a different type of vaccine than the ones made by Pfizer and Moderna. It works by using a harmless virus to prompt your body to create antibodies to COVID-19. Nearly 44,000 people from all races and ethnicities participated in trials of the Johnson & Johnson vaccine. These trials occurred at different times than those for the Pfizer and Moderna vaccines, in areas with different levels of background transmission and at a time when we were starting to see variants emerge. It is difficult to compare the efficacy rates of the three vaccines because the circumstances surrounding the trials mean it is not an apples-to-apples comparison. What's most important to understand is that all three vaccines are highly effective and successful at preventing hospitalizations and deaths, and those are the results we want to see with any vaccine. Our recommendation to Hoosiers is to get whatever vaccine is available as soon as you are eligible to get it. We are in a race between the vaccine and the variants, and we want the vaccine to win. I wanted to talk a little more about what the governor touched on earlier. As you know, yesterday we expanded eligibility to Hoosiers 55 and older, and today we are adding Hoosiers age 50 and older. Hoosiers age 50 to 59 are 30 times more likely to die of COVID-19 than people age 20 to 29. Now that we have opened eligibility to Hoosiers age 50 and older, many people are wondering who is next. Our external advisory committee met on Monday to review the Johnson & Johnson vaccine and discuss next steps. The committee's consensus was to continue to open eligibility based primarily on age, because data show that the older you are, the greater your risks are of hospitalization and death from COVID-19. We know that people ages 40 to 50 are at 3 times greater risk of being hospitalized and 10 times more likely to die if they contract COVID. Because of this, we will continue to expand eligibility by age group incrementally down to age 40 as our vaccine supplies permit. We also know that when we are able to vaccinate people age 40 and older, we will have captured 91% of Hoosiers who fall into the CDC's list of high-risk comorbidities. Once you add in the Hoosiers age 16 and older who are eligible based solely on specific comorbidity that we have already added, the percent of all Hoosiers with comorbidities that we have made eligible is even higher. This week, we have started to send invitations to sign up to get the vaccine to Hoosiers with sickle cell disease, Down syndrome, actively on dialysis, solid organ transplant recipients, and Hoosiers actively receiving treatment for cancer now or within the last 3 months. If this describes you or a loved one and you have not yet received a message, do not fret. These will continue to be sent over the next couple of weeks as your providers input your names and information into the system. It is appropriate to check in with your provider to make sure your information is getting submitted. We will also continue to look at and add other comorbidities with increased risk and incorporate them as vaccine supplies allow as we continue to move through the age groups. More on that to come as we continue to do our work. As with this week's expansion, opening vaccine to more Hoosiers is solely dependent on the availability of vaccine. We have been told not to expect additional Johnson & Johnson vaccine for the next couple of weeks. So our plans, apart from the mass vaccination clinics, will depend on the supply of Pfizer and Moderna. Our age-based approach is working. It is being driven by data, and we will stay the course, and we will continue our work to reduce hospitalizations and save lives in Indiana. Now it is my pleasure to introduce Dr. Roland Walker, who is a pediatrician in Gary, serves as the city's health officer, and has a personal story to share about COVID-19. Welcome, Dr. Walker.
Well, thank you very much for having me here. Welcome from Gary, Indiana. Our Mayor Jerome Prince, as Gary, Indiana is nestled in the northwest corner of Indiana near Chicago. I do want to talk about a couple of things. First of all, we're almost at the 1-year mark now where I first announced, one of the first public figures to announce that I had contracted COVID, as well as my parents who suffered serious illness, although I was asymptomatic, they suffered serious illness. So while trying to manage our response, our local response to COVID, I was also trying to manage my family response. So it's really personal to me, and I take this COVID very seriously. Whereas there's been over 500,000 people that have lost their lives in this nation to COVID. We've had now 147 deaths just in the city of Gary alone. We've had 5,093 cases. So our rolling 7-day average is down to 4 cases, which is fantastic. That mirrors what's happening in the state currently. Our cases are down. But now, of course, is not the time to become complacent. As Dr. Weaver just has stated earlier, variants are coming our way because that's what viruses do, right? Viruses are meant to mutate. So now is the time where we need to really try our best to get as many people vaccinated as possible. The other thing we want to make sure is that we continue to do significant amount of testing. I will tell you, even in the city of Gary, testing is down. We've maintained all of our testing sites. So the state has helped us through testing at the Gary Health Department, as well as Gary neighborhood centers. Um, Methodist hospitals continue to do drive-up testing there at their North Lake campus. Edgewater Health has continued to do testing, as well as a private company that is partnering with the city of Gary, Agile. So testing has continued. We encourage people to continue to get tested. And we've had 2 consistent vaccination sites in Gary. And that's at the Gary Health Department, which we've moved our site to the Holy Angels Gymnasium as we expand, as well as the North Lake campus of Methodist Hospital. So the exciting news, obviously, that everybody has referenced there has been the Johnson & Johnson vaccination, which is going to be a single dose, which is going to allow us to be more aggressive with vaccinating the homeless population, our housing authorities, and people who have problems having access to healthcare. So this is very exciting news to us. We're very thankful to Governor Holcomb, of course, Dr. Box, Dr. Weaver. Also, I want to throw in there the people that have helped us, because as we're moving toward doing a mobile vaccination center coming up at the end of March, as referenced earlier. Dr. Shirley, our senator here, Senator Eddie Melton, our state senator, have been very instrumental. And so we're targeting the dates of March 20th and March 21st, as we want to do mobile centers at Calumet High School. So that allows us also to target a different area of the city. As people know anything about Gary, one thing we're not lacking is landmass. So Gary's a 52 square mile city, and we have to move around to be able to give people good access to healthcare. As you can imagine, particularly in the inner city, there's vaccine hesitancy. And of course, that is concerning. And also, I want to state that it's rightfully so that people have this hesitancy, particularly in the African-American community. There's a distrust because there's been some experimentation, there's been misinformation, mistreatment in the African-American community. But I'm here to tell you, I've had the vaccine. I've had my octogenarian parents had the vaccine. I've had all my aunts had the vaccine that are of age. I've encouraged all my friends, family members, coworkers to get the vaccine. I've been fully vaccinated for, I don't even know how long now, a month and a half. And I've done very well. And I encourage everybody to do it, because we need to do it before we start seeing the upticks that we do expect, because we'll see variants. So one thing that I like to reference all the time is in an African-American community, they often quote the Tuskegee Experiments and say, well, people were given syphilis and then they were allowed to die. But that's actually not accurate. What was happening was actually with the Tuskegee Experiments, as people were denied treatment. They were already infected, and then watched to see how the illness would progress over time. So for us not to encourage vaccination, for us not to give access to vaccination would be more apt, better comparisons to Tuskegee Experiments. So I say that to encourage people of all backgrounds that this is very important. It's been well studied, and this vaccine is extremely safe. So to protect yourself, protect your family members, loved ones, now is the time, while we have good supply flow, while the president has said that we expect for everybody over the next, by the end of May, everybody that wants a vaccine to be able to get a vaccine, then that is what everybody should do, so that we can return to some form of normalcy. I encourage everybody to continue to wear your mask. I have been fully vaccinated for quite some time. I continue to wear my mask, whereas one, I'm modeling behavior. Two, we don't know everything about the spread, so we still continue to wear our mask until the CDC recommends otherwise. But once again, I do want to say thank you to Dr. Box and Dr. Weaver, who have worked well with the Gary Health Department, so that I think that we've done very well in our community to prevent spread. I also want to say thank you to Governor Holcomb and Mayor Prince, because I just want to say that I think that most health officers would do similar things, but it's when you have the politicians that help you to put forth some of these things to protect our population, that's where you're able to make a difference. So thank you so much for this opportunity to speak. I appreciate it very much.
Thank you, Dr. Walker. And I trust you'll be able to stay with us throughout the program, and just as you have been with us every step of the way for more than a year.
Yes.
So thank you for helping spread the word about awareness and the word about access, and then making sure it is provided. We appreciate that. Rachel, you want to?
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay. This is usually when Rachel says you have to unmute your own microphone.
It looks like she is unmuted. So
That could be, do we need to unmute?
we'll come back to Lindsay.
We'll circle back, I promise, Lindsay. Come back to you right after this one.
Meredith Hackler, WLFI.
Good afternoon, Meredith.
Problem might be on our end.
Meredith, you need to unmute your own microphone.
Hello, are you there?
We are here.
Sorry about that. I was anchoring the intro and outro of this show, so I was just on air for like 5 seconds and I had to toss the break really quick, so I apologize.
No faz mal pa, as they say in Portugal.
Okay, so here we go. I have a couple of questions for you. So last week I wanted to ask you about the dashboard that AARP recently released. It ranked Indiana as having one of the highest death rates in the country in nursing homes, and along with that, they mentioned that there was enough staff to, accommodate for that. So I was wondering if you guys are looking into that or addressing that at all.
Talk about the nursing homes. I don't think Dr.
Sure.
Dean's with us.
No. Most certainly, yes. We discussed this a little bit last week, but I'll kind of review that. The state of Indiana has had a significant number of deaths in our long-term care facilities, as has many other states. We, in the state of Indiana, tend to have a higher percentage of individuals in our long-term care facilities, in particular age groups, and we know the congregate living definitely put individuals at risk. The other thing is that Indiana overall ranks very high on our number of smokers, our obesity scale, our complications associated with that, which include diabetes and heart disease and stroke. So all of those things contribute, unfortunately, to how an individual would do if they got COVID-19. That being said, everything with our long-term care facilities is being looked at very, very carefully with regards to staffing ratios, the infectious disease prevention efforts. All of those were things that we have addressed from day one with this because we knew this would be a concern. That's why you've seen a lot of assistance in our long-term care facilities to help out. And we will continue to improve our relationships and the care that individuals in our long-term care facilities receive.
I don't mean to put you on the spot on this, but we were just talking about this, Meredith, and as in terms of the total number of deaths, if you rewind the tape just a few days ago, it was about, or weeks ago, the figure I had was 44% of our total deaths. That has dropped significantly.
Yes. As has our deaths. We're
Yeah,
talking
sure.
now, it accounts for maybe 17% of our deaths. Right. So I can bring some of those numbers next week, but as I've looked at the graphs, it's a tremendously huge drop, not only in numbers of cases, but numbers of deaths, which is exactly what we hope to see with vaccinating our individuals in long-term care facilities. And we had an excellent uptake amongst our residents.
And that's why part of the rationale was starting with the most at risk, which you said in our first press conference over a year ago. We're going to start with our most at risk. And kudos to the Indiana National Guard for helping us staff up in those long-term care centers to relieve some of that pressure. And I think, Meredith, did you have two questions before we go back to Lindsay?
Yes, I did. And I'm so sorry. I apologize. I'm doing like 5 things over here, anchoring and talking to you guys. My other question is just how many people do you guys expect to be vaccinating at these mass vaccination sites every day?
Lindsay, you want to take that one? She's excited to talk about
We're
these
hopeful
sites.
about this, yeah.
I am very excited to talk about these sites, and I'm just going to take the moment to really get into what's going to be happening at the Motor Speedway this weekend. So we're going to be doing close to 4,200 people a day. We're hoping to be able to expand all of our mass vac sites, but unfortunately, as I shared earlier, found out we would not be getting any more Johnson & Johnson over the next couple of weeks. But we do have enough to continue with our mass vac sites. So this weekend, if you are one of those people who are eligible and have signed up to get the vaccine, you're going to pull into the Indianapolis Motor Speedway, go through the typical registration process. You will stay in your car the entire time. So really a drive-through mass vax location. You'll actually get your vaccine in the garages on Gasoline Alley. And then after you get your vaccine, you'll pull out either right onto pit row or right next to pit row. And then, of course, you have to still do your 15 minutes of waiting afterwards. But after everything's fine, then we will wave you out. So it's really exciting. A lot of wonderful work went in from my team, Megan Lytle, and lots of others who have been working tremendously so that we can get lots of vaccines in arms as quickly as possible.
Lindsay, I'm envisioning you're going to get the green flag as you pull in, and you're going to maybe get a caution, hopefully not during, and then you're going to get the checkered on your way out. Back to Lindsay or someone else?
Yeah, we fixed our glitch.
Okay, good.
Lindsay or Dodie with the IBJ.
Hi, Governor. Can you hear me now?
Yes, ma'am.
Okay, great. So a few questions about the federal vaccination program and how that's going to work with what the state is doing. So just wanted to ask, is it only going to be at Meijer, Kroger, and Walmart, or other pharmacies involved? And then how would, a teacher who's younger than 50 sign up for that? I'm assuming it's not through the state's system to sign up. And then will all of those federal doses be accounted for in the state's vaccination data?
I can answer all three, but Lindsay, I think I teed you up for all three of those questions when we huddled up earlier, just knowing that every teacher is asking the very same question. You want to articulate how this process, as we know it right now, but Lindsay, we are asking more questions, and we do have a lag, so that the information will ultimately get to us. It's just kind of behind the times when we're trying to track spread in real time. But you want to just take one, two, three, those three questions, Lindsay?
Yes, Governor, your point's well taken. We're still learning more information about exactly how this is going to work for teachers here in Indiana. So our federal pharmacy partners, or the federal pharmacy partners in Indiana right now, are Kroger, Meijer, and Walmart, do have their own sign-up systems. They are still on our map. So if you would go to rshot.in.gov and you pulled up your county and the counties that live around you and looked at the map, you'd be able to find those locations. But as mentioned, still waiting to learn more details. Did I miss one of the questions in there?
Yeah, Lindsay, what do you?
I think you covered most of them.
I'd asked if the vaccinations given through the federal program will be accounted for in the state data.
Yeah.
Right. So those allocations are actually coming separate from the feds, basically. So we get our state allocation; those go out to all the states that are participating with us, and then those partners are getting a different allocation.
Yeah,
but
so
we will still be able to account for it. All of that will be up on our website. They have to report it into CHIRP, so it still shows up on our dashboard as vaccines counted and done in Indiana.
But just so folks are clear, they're scheduling with those three different entities directly with those three entities and sites, not 2-on-1 and not our website.
Although they can find the locations
Right.
on our
Yep.
website, which
Yep.
is great.
So if you're in, I'm making this up, but if you're in Posey County and there is no Meijer, there is no Walmart, there is no Kroger, you're going to go to Vanderbilt County or something nearby that can accommodate, or you're going to go to any of the other sites if you're 50 or above as of Friday. Yes.
Abigail with the Brown County Democrat.
Good afternoon, Abigail.
Good afternoon, Governor. Dr. Box, can you hear me okay?
Yes.
Yes.
Okay, good. So I have a question that is probably a few questions wrapped up into one. At what point is the pandemic more or less over with pre-pandemic life resuming? Is there a number health officials are watching for as far as positivity rates or hospitalizations, vaccinations, and just what is informing those decisions?
That's a really, really difficult question. It is going to take time. It is going to take time to get everybody vaccinated And we're not going to be able to call this pandemic over with mutations and the other things that are happening with this virus until we've really protected more of our population and really decreased our cases and kept those cases down. The governor knows that one thing I always like to look at is the number of cases per 100,000 that a county has. My real happiness is that there is only one county in the state of Indiana over 200 right now. Many, many, many are below 100. So it's really been good to look at that and see that happen. But we really need to see that we've got a handle on what's going on with the variants, that we've got more people immunized, that we see these cases per 100,000 and percent positivity stay down, and that we may be looking at the potential of doing boosters in the fall for individuals that are willing to be vaccinated, because I know that even Moderna and Pfizer right now, potentially Johnson & Johnson, are looking at vaccines against some of these variants that we know are causing more issues as far as spread. But the really, really important thing to remember is that all of these vaccines prevent hospitalizations incredibly well and have prevented death. And that's really our goal.
Yeah, and Abigail, I mean, the more important thing is, because this is a public health question at large, is how do we manage day by day through it? The virus, you know, when is it going to end? We've got the flu every year. People get vaccinated every year. So I think that's, you know, an impossible question to answer, because we don't know. But what we do know is we have more control now than ever, and it's paying off. In part, when you look at the previous surges, we didn't have a vaccination to bring down those hospitalization rates and those deaths. Now we do. So, of course, our actions, vaccination, that's what's leading us to this better place right where we sit today. You had a second question, Abigail? Or was that all wrapped up into one?
That was all wrapped up into one. Thank you.
Yep, perfect. Thank you.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. I'm sure you are aware that your counterparts in Texas and Mississippi have said that we no longer, or their residents at least, no longer need masks. Can you address when, if you have any insight into when that might happen here, or whether that you feel that is, we're at that point now? And Dr. Box, I have a very, for my own clarity, I'm sorry, when Johnson & Johnson single vaccinations show up, how do they show up on the dashboard? Are they first dose? Are they fully vaccinated?
So they'll show up as fully vaccinated individuals on our dashboard. One dose, and they'll show up as a fully vaccinated individual.
Yeah, and I would say, Sherry, that when you look at different states, I sometimes get a kick out of this. When you actually read the fine print, not all, but when you read the fine print, many states that are opening up not even to the level we're at right now. And so when you scratch at it a little more and they say we're opening up sporting events to 50%, they are loosening restrictions in regards to Texas and Mississippi that you cite. I'm good on them. They got great leaders, but I'm looking at very local information. I'm very Indiana-centric about this, and I'm really happy about the path that we're on to get to that light at the end of the tunnel. But, you know, when you look at our map, the color-coded map, and you see all that blue, we're able to operate, and we're open. And so it'll be over when it's over, but I'll make sure that it's the data that's coming across my desktop. And sure, I talked to governors, did last night, across the whole country, so we're very aware of what people are thinking. But all I know is we're on the right path, and the thing that's different about right now is, and what really drives me is having vaccination available to the most at risk, including those comorbidities. And we are on the path. And once we get through that, I'm going to be a happy camper.
Tanner with WFIE.
Tanner, good afternoon.
Hi, good afternoon, guys. Can you hear me?
Yes. Crystal
All right,
clear.
So I've got All right, great. I've got two questions for you, Dr. Box and Dr. Weaver. This is more directed at you guys, but Governor Holcomb, if you'd like to chime in, feel free to.
Thank you.
So it took Indiana about a week to expand eligibility, not once, but twice. So do we expect eligibility to continue to expand that quickly?
Well, again, I'm a bird in the hand kind of woman, but we have been given the impression that we are going to have vaccine coming in enough amounts that we may be able to continue to expand a little more quickly. I would really be thinking that by mid to late March, we're to 40 and above. But again, bird in the hand. We were very excited about our mass vac sites and thought we were getting all this Johnson & Johnson vaccine, a larger amount this week and then some each of the next 2 to 3 weeks, and then found out shortly thereafter that we weren't going to be getting any for the next 3 weeks. So we really have to go based on that, but I do believe that the vaccine supply has begun to increase, and so it allows us to move through these groups a little bit more quickly and to make sure that we're going back and picking up other high-risk conditions or comorbidities that are still out there that we know, along with age, significantly increases an individual's risk. Lindsay, do you want to add anything to that?
I agree with you 100%, Dr. Box. We will move as quickly as supplies allow and have been. We have great partners that are willing to just pivot and keep on moving forward. All the vaccine locations across the state are just excited to expand eligibility. As we are, like I said, we are expanding schedules. So not only do we have these new mass vax clinics, but we're also expanding other clinics across the state, their schedules. As we get a little bit more vaccine, we can add additional appointments, and we'll be putting some new sites on the map as well.
Yeah, and I would add, Tanner, thank you, that you say you're a bird in the hand. You're also someone that it seems to me that would prefer to under-promise, over-deliver, and prepare for kind of Lucy pulling the football out in front. So you're not, we're not putting out a mass communication and then have to change it. So we're very methodical, very cautiously optimistic about what we can do. And as Lindsay mentioned, credit to 211 and to our website and to Zotec for being able to manage these surges. So when you get 110,000 people within 24 hours, I wouldn't want the story to be we opened it up to 457,000 or 858,000 and it crashed the system. Then we'd be dealing with that today. But we're just very methodically mowing it down and making a lot of progress on a daily basis.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon, Governor. I have a question about whether, I have two questions actually, but my first is whether you would require schools to reopen after teachers get significantly vaccinated through the federal program. I know we don't know the timeline for that, but I was wondering if, 89% are already fully reopened, if you would push for that last percentage to get over the edge.
Yeah, we've encouraged it, and I'll continue to encourage that it can be done safely. And obviously, this would be just yet another data point of comfort, I would believe. But the 10% are looking at their community spread. We've given schools, the federal government as well has provided a lot of resources, and we have as well. And when you look at that 89% that are proving it can be done, I would hope, speaking for myself, I would hope that we would all find a way for in-class instruction. It's happening right now. We're going to have to deal with the ill effects of it not happening if it's not down the road. So, better now than later. You had another question? I think she had two, maybe. Whitney?
Oh, sorry, I had to unmute myself again. My second question is about vaccine hesitancy and what we're doing to overcome that. Men are still getting vaccinated at lower rates. A lot of rural counties not picking it up as much. And I wanted to know specifically about healthcare workers and nursing home staff who were not choosing to get vaccinated.
Yep.
So Lindsay, do you want to take that one or do you want me to take that?
Yeah,
Okay.
Thanks. That's a good question. It is something that that keeps me up at night. So we are doing as much education as we possibly can. We do know a lot of people are waiting. I've already had healthcare workers come up and tell me that they just wanted to wait a little bit and are now jumping in line to get their vaccine. So we're excited to hear that. Again, we knew in the beginning a lot of family members were signing up their loved ones, their elderly loved ones, to get the vaccine. I encourage you to do that also for your male loved ones who maybe are just putting it off or are wondering or maybe just need a little bit of support. So, reach out to your family, everyone who's eligible. What can I do to help? I'll go with you. I'll hold your hand, whatever it is that they need. We all need to encourage each other. Please don't wait. It is heartbreaking for us healthcare providers when we take care of somebody who has COVID and is sick from COVID, and they have met that eligibility criteria for some time. We don't want to see those patients in our hospitals and anymore. We want everyone to be vaccinated so they don't require that hospitalization. So lots of work to occur. We're going to continue to do outreach. We're getting our mobile units out there as well. We'll be able to share more with you all about soon where those locations will be and what that rollout will look like. But as much as we can do to encourage one another, I think that's what we need to be doing right now.
Yeah, and we're going to stay with it. I mean, we're never going to let up. We're going to continue to measure this. We'll share it. This is an encouraging sign. When we were months ago talking about what the percentage might be, it might have been half this in some cases. But, we understand there's the kind of wait and see then me approach with some groups. And the good news is, you just mentioned, J&J, the efficacy. I mean, you might share. I mean, that's
93% effective at preventing hospitalizations. In fact, in their entire study, I think it was 44,000 people, only 2 people were hospitalized, and no deaths. So that's really what we're looking for, and that's what we need to underscore and why we want people to get immunized. And it's so easy, one vaccine, right? But I think it's also important that we can look at our data and see where there are gaps or holes in people getting vaccinated. We can know maybe that's a Latinx community, maybe that's an African American community, maybe that is a rural area. And then we're working within our communities to get trusted leaders within that community who have been vaccinated and educating those individuals about how they can sign up and educate their community members, their church members, if they may be in a community center or in a local YMCA to get people signed up.
We're all in it together. Next.
Chris Darby, Wayne 15.
Afternoon, Chris.
Hey, good afternoon. I'm going to follow up a little bit more on the masking question with the other states. Congressman Jim Banks has really become a national voice that is one of the more high-profile people asking, to end this mandate. What are your interactions have been like with him, and how are you kind of handling this pressure to not follow those other states right now?
Yeah, I've not talked to him directly. He's a good friend. I'd be more than willing to. But I think I share his sentiment about wanting to get through this. We just need to do it looking at Indiana numbers, not Texas, not Mississippi, not Nebraska, not Vermont. I'm on the phone with all these governors. They're all very respected voices in the country, but I'll continue to focus on what's going on in Indiana, not around the country.
Dan Klein with Wish TV.
Hello, Dan.
Oh, good afternoon, Governor. You already have alluded to President Biden's announcement yesterday, and throughout this pandemic, you've really emphasized targeting those most at risk of complications and death, as you have today as well. But, Governor, how do you feel that teachers are going to be able to bypass state guidelines is my first question. And then my second question is, beyond just the number of vaccines that are coming in, what changed so that you were able to open things up so quickly? And are there any other comorbidities that you will be considering adding to the 40 and up group once that happens, possibly middle March?
Yeah, my concern is, and you're right, Chris. I mean, we have taken the approach that it's not the occupation or vocation, it's your condition. And so we're trying to be guided by the science and the medical data and the comorbidities, and age is the single biggest factor that contributes to your risk. And as soon as we get through that, so what I don't want to have happen, and what will happen in other states around the country too, this is what a lot of governors are worried about, is you'll be pushing some out who are more at risk. And that's my concern. My other concern is that we don't have sight or eyes on real-time data, and we're trying to control spread in our counties. And we've put a lot of effort in over the last year to stand up a system that's almost real-time reporting on this virus. And this just delays that. There's some information delay, so we're kind of back in the fog. Now, we'll get that information ultimately, maybe 3 days later, but it sure would be nice to have one system. I think what we're proving through that one system, 211 in our website, is it's very efficient and we can be nimble. My third concern, and then I'll pitch it to you. My third concern is what doses, what's the accounting of doses? So when we hear we're going to have 3 weeks of this number, but then a day later we hear actually not week 2 or week 3, that makes it harder for us to plan. And we're curious, as are other governors around the country, the accounting of those doses, because we've got folks all over the state of Indiana that are obviously lining up and want their vaccine. It has nothing to do with vocation. And so those are my 3 concerns in 30 seconds.
So I'll probably end up pitching this to Lindsay, but what I want to say is that I think that people down deep think maybe we needed more people to run vaccine sites or we needed more vaccine sites, but it really has been about not having enough vaccine to get into arms. We really have been pulling down everything that the CDC offers and getting it out to our vaccine partners across the state who have been begging to be able to open more lanes and do more vaccination. And we've had a large number of hospitals and even federally qualified health clinics and community health clinics that would like to have this. So Lindsay, do you want to add to that, give some more perspective?
Yes, so I think just to go back a couple of weeks, we were hoping to be able to move forward that week. We had that bad weather, so it kind of got pushed back a little bit. So I think that we are actually close on the timeline that we thought we were going to be, but we've had these small incremental increases, which week after week doesn't really make huge differences about how much extra vaccine we have. But if you go back and you look 4 weeks and where we're at now, we do have enough where we're able to move faster through these different eligibility groups. Also, there's vaccine coming into the federal pharmacy partners, vaccine coming into our FQHCs through their federal partnership as well. And then if you add on that another 50,000 vaccines with Johnson & Johnson, which is just one dose and we're done with those people, we are in a point where we're going to be able to move quicker through the different age eligibility categories. I think the other question was specifically about comorbidities. So again, I am blessed to have all of these experts across the state to help us think through this. We're working on a list. We're reviewing CDC. We're reviewing data. We're reviewing the wonderful things that people send me about different groups are at higher risk. And we're also looking at other states and talking to them about why they may or may not have added different groups. So we'll come up with that list. We'll get it reviewed. We'll have the experts, our infectious disease experts, and other people take a look at it to make sure we're right on track. And we will definitely share it with everybody as soon as possible.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Afternoon. I have 2 quick questions. One is, now that we have a one-shot vaccine, but with slightly lower effectiveness, will Hoosiers get any choice in the matter? Some people might want the one shot for convenience. Some people might prefer the 2-shot for efficacy. So that's one question. Yep. And then the second is, originally we were supposed to move to critical infrastructure and phase 2.
Yep.
But we seem like we're just going to stay in 1B forever. So have we just abandoned that part altogether? Are we just doing age-based and that's all from now on?
So I'll take the choice part of it. Our website, if you go, you should be able to tell based on where you're scheduling what vaccine is there. And we do see people have different preferences. And again, the thing I want to underscore is get the vaccine that you can get, the quickest that you can get it. I think we're probably looking at booster doses for all of these. When you look at the efficacy, I think it's important to remember that both Pfizer and Moderna completed their studies long before we had these variants of concern out there. It was a different timeline for our J&J, and it was a different geography. And J&J actually has very, very good efficacy, as I said, for preventing hospitalizations and death, and that's our main goal. I think the other important thing is that we have had sites that have had originally when we just had Moderna come out, so we had hospitals that had both Moderna and Pfizer, and that became rather confusing, especially when we were trying to have people come back and schedule for their second doses. Is it 21 days? Is it 28 days? Do you need Moderna? Do you need Pfizer? Which one did you get? And we want to make sure, they wanted to make sure that it was easy to be able to know everybody here is getting Pfizer. So it's not like you'll go to the site and be able to say, oh, here's the 3 of them. I want you to pick this. I want to pick this one. And it really is about streamlining that process and being the most efficient we can. Lindsay, do you want to address the other question?
So we have not vaccinated all the vulnerable Hoosiers that we would like to vaccinate yet. So we are still in that very important phase of decreasing hospitalizations and saving lives. So as a reminder, people who are 40 to 50 years old, and this is national data and also Indiana-specific data, it actually is right exactly the same. 3 times more likely, if you're between 40 and 50 years old, 3 times more likely to be hospitalized and 10 times more likely to die. So it's because a lot of those people have comorbidities, whether they know it or not. So it's very important that we move through that. It's equitable, it's fair, people know exactly what it means. In addition, we're going to be picking up some of those younger people that have those very at-risk conditions. Once we move through these, just as we did today, and we start to click through these increments of age, then we're going to, again, meet with the advisory committee, talk about how much vaccine do we have, what are our next steps, and then we'll step forward and say, okay, this is where we're going to be moving next.
March is important. And Dr. Walker, we're leaving the Indianapolis light on for you when you want to come on down. Thank you for dodging any tough question today.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.